an aesthetic doctor, as she's introduced herself to you. But I'm really fascinated, Aggie, because you've been seeing patients come into your Surrey clinic for years now, and you've been treating all manner of aesthetic concerns. But what are patients really looking for now from their treatment?
When my new patients start, I don't know if you can hear me, I will speak loudly.
It's going in and out of it.
When my patients see me for the first time, it is usually because they start to lose control over certain elements of aging. And it's usually one last straw, it's usually what tips the scales, is one last thing, one little line, one little more imperfection, and that's where they think, okay, it's time to speak to someone about that. So for me, this is a real opportunity a very unique opportunity to actually start to have a broadened conversation about what happens when we start to age and how we can age proactively. So even though those patients come to see me with something maybe a little bit more superficial, I try to use this opportunity and bridge the gap between what we consider a classic medicine, which is the management of disease really, to start to talk about preventative medicine and things that we can do. So I think it's a real opportunity and responsibility to do that.
I agree, and it's interesting that you said people come in for something superficial, or as they might deem it, sort of superficial, surface level, but so often, and I think all three of you will probably find this in your respective specialisms, it always runs deeper than that. It's never just something on the top
of the iceberg, isn't it?
It's the straw that breaks the camel's back, as I think essentially you were saying. But do you feel that modern lifestyle, the fact that we are moving faster, we are trying to wear more hats, we are juggling more, we're working longer hours, but also there's this sort of focus on our mental health and our sort of looking after ourselves outside the professional world. Do you think that's driving a lot of people to your door as well?
Absolutely. We live under unprecedented stress, chronic, constant stress. The pressure of life at the moment, juggling so many balls and doing so many things and striving for perfection, that leads to chronic stress, and that affects everything. And if we add to it perimenopause, menopause, children and work stress, etc., all of a sudden it just becomes a little bit too much. So the first things that patients may come to see me is, I look tired, I'm changing, I don't recognize myself in the mirror, what's happening? So that's where we start to obviously address those issues, because those issues bother the patients, but also we address many layers on what's actually happening to our body. And I think we start to have those conversations and educate patients, and often patients come to us very educated and they just don't know where to look for help. And
but sometimes it's what is it called, analysis paralysis. You can know so much, but you don't necessarily know what to do with that information. And you mentioned layers there, and you're obviously talking about more of a psychological layers, but also it strikes me that when we're talking about aesthetics, facial aesthetics a lot, we do talk about different anatomical layers and the importance of understanding how to address them. So you might have the muscle, you might have the fat, you might have the skin, but specifically thinking about the body and how to build a stronger body, why do we also need to take that approach, that sort of layered approach to the physique?
I think it's commonly understood now how we age in terms of facial aging and facial layers. And I think most practitioners and most patients understand that, this is a multi-layered process and certain layers need to be addressed, but it's exactly the same in the body.
Yeah.
So it translates directly. Actually, even more so, and even more importantly, we have to think about different layers. We have to think about, if we think about longevity, we need to think about about bone health, about muscle health. And I'm sure my colleagues will be diving a little bit deeper into that. But we need to talk about muscle if we're talking about body. Patients often come to me and ask, what do I do with cellulite? What do I do with the skin laxity? And yes, that needs to be addressed. But we also have to think about what happens to the muscle.
And what's underpinning all
and
of
what's
that.
underpinning and about the framework, which is our bones. But it's so much more than that. Muscles take a crucial role in regulating inflammation, in preventing the insulin resistance, and
particularly through age, and we're sort of hitting that perimenopausal, menopausal, having really good muscular mass is definitely going to do us well.
Estrogen is going to massively decrease the mass of the muscle, and then therefore the mass of the bone structure. And if we think about where we are now with the epidemic of osteoporosis, where half of women over the age of 50 will in their life will have a fracture related to the osteoporosis. Third of men after the age of 60. So these are quite serious numbers. If you think about the diabetes or insulin resistance, that is related to muscle mass as well.
And another soon to be potentially epidemic will be the GLP-1 antagonists and the weight loss medications that are obviously also driving.
This is a huge topic now, because a lot of patients openly or less openly are using GLP-1, so all of the weight loss medication. And because we screen patients and we talk about this, and also they feel like it's a safe space and they won't be judged, they often admit that they are doing it. And often it's an online medication, often it is something that is not really related to a GP consultation, so they're not that aware of the potential risks. And my worry is that we will have even bigger problem and really an epidemic of osteoporosis and problems with muscle wastage, because that leads not only to fat loss, but it leads to a massive muscle wastage and therefore osteoporosis. So I think this is an opportunity to educate patients and spend this time to explain that it can help and it can save lives and prevent cardiovascular diseases when we talk about obesity. But for patients with normal BMI, it can be a massive problem in the future.
I definitely agree. And on that note, muscle stimulation, you've mentioned the importance of building muscle, preserving muscle mass. What can you do in clinic? Because muscle stimulation is, it can be really valuable to help sort of women and men, obviously, in that way.
Absolutely. Oh, this is working now. So
it's always a surprise when it suddenly jumps back in.
Obviously, the main thing is the healthy lifestyle. So we need to talk about the regular exercises, healthy diet. This is the base of everything in terms of longevity and lifestyle medicine. And we have a lifestyle specialist in the clinic as well to advise about nutrition, about the exercise, etc. But often we have patients who almost feel like, I need a little bit of a boost, I need a little bit of help. And if that's the case, we use the HIFEM technology, which is the high intensity focal electromagnetic stimulation. It's
that's quite a mouthful, well done.
But that's the EM Sculpt Neo device that combines this electromagnetic stimulation with radio frequency. And we can use big muscle, we can use it on big muscles to increase about 20% the mass of the muscle, and therefore help to really stimulate.
And it's interesting because you can do it in such a targeted and localized way. It's literally isolating like your glutes or your calves. And for some people, I think also it's so difficult to build muscle in certain parts of the body. So it's really interesting that you can really accelerate that muscle gain.
It can be very targeted. Also helps patients postpartum, post-pregnancies when they have diastasis recti to just bring those muscles together without surgery. So that helps to in a more less invasive way to improve the muscle health. And therefore bone health, if you think about it a little bit deeper.
Yeah, exactly. And it's so interesting that there are so many of these technologies now which are almost becoming the non-invasive route to try and do potentially what only surgery has been able to achieve before. Another muscle that absolutely needs safeguarding as we go through life is the pelvic floor, and not just for women but for men as well. At what point in life do you think it's really important to start thinking about our pelvic floors and really starting to think about how we can go about strengthening that in a more proactive way?
For all women after pregnancies, that's 100% of women after pregnancy, the stimulation of the pelvic floor muscle is crucial. And for everyone who starts to experience a little bit of decrease in estrogen. because that will immediately translate into the weakening of the pelvic floor muscle. So I'm on a mission to make every one of my patients try to sit on a micella chair. You sit fully clothed, just like that.
Actually, it looks a lot like the
just
chair
like
that you're
that.
sitting on. It's not covered in blue velour. It's sort of more leathery, but
but it's blue chair. The patients sit fully closed, and it is so important. This is something that will eventually prevent issues with incontinence, with prolapse, it will improve sexual health for patients. Patients not often want to talk about it to start with, but having something like this in the clinic, right there in the open, and discussing that this is something we can actually help my patients with, women and men as well. It is surprising for a lot of patients, and they find it very, very effective.
And I think as much as it's brilliant for the postpartum, I think even sort of getting your body into a place where it's strong enough as well, and really sort of making it more resilient ahead of potentially carrying a baby. I sat on the Enquire chair quite a lot before I had my son. At least I sort of, I don't know, preventative. I didn't sit on it enough afterwards probably, which I probably should have done. No, that's super interesting.